In this PowerPoint, we're going to go over the axillary artery and its branches. The axillary artery is a continuation of the subclavian artery, and this is a shadow here of the heart with the aortic arch, with the brachiocephalic trunk, and then right subclavian artery, and then right common carotid artery. The subclavian artery is going to go underneath the clavicle. That same vessel will then change names to axillary artery. So the region we're going to be looking at today is the region from here just past the first rib to the border of the teres major muscle. So this section right here. And it's important to keep in mind this is the same vessel, the same artery, it just changes names depending on the location. So subclavian underneath the clavicle, then it changes names to axillary artery because it's in the axillary region. Once it passes the teres major muscle, it changes names to the brachial artery because it's in the brachium. And then it will bifurcate into the radial and ulnar artery. So we'll go through this a little bit later, all these branches here, and actually the subclavian artery branches we'll talk about in Unit 2. But today we're going to talk about the axillary region and its branches. This is a cadaver image of a left anterior axilla with the pectoralis minor and major reflected. So what you're seeing here is the distal end of the subclavian artery, and then part 1, part 2, and part 3, this is all axillary artery. Axillary artery will then change names once it passes the border of the teres major muscle to the brachial artery. Okay, so right here, this is all axillary artery. And the three different parts of the axillary artery are named for their position in relation to the pectoralis minor muscle. Part 1 is proximal to it, part 2 is deep to the pectoralis minor, and part 3 is distal to it. And whenever we're talking about arteries, when we talk about proximal and distal, on this section, it's pretty easy to tell which way is which, right? Because we're closer to the shoulder, and then as we move down the arm, proximal to distal. Okay, but it is in the direction of the arterial flow. Okay, so part 1 of the axillary artery, part 2, and part 3. Each of these different sections have a particular branch or branches that come off of that section of the artery, so it will help you in identifying which branch you're looking at, not only in looking at where that branch is going to, because that's how you can determine and ascertain that is the particular branch you are identifying, but also its relation to the pectoralis minor muscle. What I've drawn out here would be the right anterior view of the axillary artery, and starting with the subclavian artery, once it passes underneath the clavicle, it then will change names to the axillary artery. Okay, the first branch off the axillary artery will branch here proximal to the pectoralis minor muscle, and this is called the superior thoracic artery. It goes to the first and second intercostal space. So it's a very small, very tiny little artery, but it is the superior thoracic artery. This is the most proximal branch of the axillary artery. Okay, the next branch is the thoracoacromial trunk. Thorax acromial, near the acromion trunk. It's a short trunk before it branches into 4 main branches going to the particular region. We have the pectoral branch, the deltoid branch, acromial branch, and clavicular branch. And keep in mind what I've drawn is a 2D figure here. So you know, this is obviously a 3D structure, so these aren't going to be in order from, you know, left to right like this. These are going to their destination, you know, maybe anterior, posterior, medial, or lateral. But these are going to be the 4 main branches off of the thoracoacromial trunk. Okay, the next branch is the lateral thoracic artery, and this will be just lateral to the pectoralis minor muscle. So this is the lateral thoracic artery. So your first three branches, superior thoracic artery is the most proximal, then thoracoacromial trunk, and then lateral thoracic. So STL, superior thoracic, thoracoacromial trunk, and then lateral thoracic. And what I would do is, the way to remember things, if you draw things out and write them out, physically your brain will remember things better. So just practice drawing this out. We're going through it on the PowerPoint and digitally, but if you will physically draw this out and practice writing out your branches and see where you, what you're remembering and what you may not be remembering, that will really help you with these branches on the arteries. Okay, so first one, superior thoracic, thoracoacromial trunk, and then lateral thoracic artery. Okay, and then we'll have a branch that will branch off anteriorly from the axillary artery, and then one that will dive posteriorly off the axillary artery and go around the head and neck of the humerus, and they form an anastomosis. And these are the anterior humeral circumflex artery and posterior humeral circumflex artery. Okay, so I just wrote anterior and posterior humeral circumflex artery. One would be anterior and one would be posterior. These would be wrapping around the head of the humerus. Okay, in your next branch, this is the largest branch off of the axillary artery. It is the thickest branch. It is the subscapular artery. So it will dive inferiorly. It will give off a branch that dives back posteriorly and goes around the scapula. It's called the circumflex scapular artery. Once that subscapular artery gives off this branch, the circumflex scapular artery, it will change names to the thoracodorsal artery. And this will continue down inferiorly and go to the latissimus dorsi muscle. This is a picture from Grant. So again, if we look at going that same direction as the previous drawing, this is the subclavian artery passing underneath the clavicle, and then you'll change names to axillary artery. This is the first part of the axillary artery. The first branch, most proximal branch, is superior thoracic artery, going to the first and second intercostal space. The second branch is the thoracoacromial trunk with its four main branches. Okay, so pectoral branch, deltoid branch, acromial branch, and clavicular branch. Okay, then passing underneath the pectoralis minor muscle, okay, which attaches here to the coracoid process of the scapula, comes down and attaches to ribs 3, 4, and 5. The axillary artery will pass deep to the pectoralis minor muscle. And the next branch is going to be the lateral thoracic artery. So you can see that's diving down and going on the lateral side of the pectoralis minor muscle, lateral thoracic. All right, this is showing you the anterior humeral circumflex artery and posterior humeral circumflex artery. Continuing on, this is the subscapular artery, giving off the branch that dives back around posteriorly behind the scapula. This would be the circumflex scapular artery. Once that is given off, it continues inferiorly as the thoracodorsal artery. And here's that same image again. So we've got axillary arteries, superior thoracic artery. These are now labeled. The previous structure didn't have these labeled. So superior thoracic artery, thoracoacromial trunk, or thoracoacromial artery, either is acceptable, okay, with its branches, pectoralis minor muscle, and lateral thoracic artery. Lateral thoracic artery. Anterior and posterior humeral circumflex arteries, subscapular artery, circumflex scapular artery, and thoracodorsal artery. This is from Olinger, so this is showing you a left anterior view of the axillary artery. So here's subclavian artery passing underneath the clavicle, changing names then to axillary artery. This is the first part of the axillary artery. Most proximal branch is the superior thoracic artery. Okay, it's going to go to the anterior thoracic wall, so going to first and second intercostal space. Okay, the next branch is the thoracoacromial trunk. Thoracoacromial trunk with its branches, clavicular branch, acromial branch, pectoral branch, and deltoid branch. Okay, so these are going to go to their named destination. Okay, then diving inferiorly is the lateral thoracic artery. This will be just lateral to the pectoralis minor muscle. Okay, so lateral thoracic artery. And this is in the second part of the axillary artery because it's deep to the pectoralis minor. Okay, the third part is distal to the pectoralis minor muscle. You can see this branch coming off anterior to the humerus. This will be anterior humeral circumflex artery, and then posterior humeral circumflex artery. And these all come together and form an anastomosis, which is just a collateral circulation around the head and neck of the humerus. There are some other places that you'll see posterior humeral circumflex artery. I'll show you that on the posterior view, and where you'll find some of these other branches seen on some other views in the cadaver images. Okay, our largest branch off of the axillary artery is the subscapular artery, right here, subscapular artery. And this will be lying right over the subscapularis muscle, so subscapular artery. Okay, you can see this branch given off and it dives back around posterior to the scapula. This is circumflex scapular artery. And then you can see it continuing on down, and this is the thoracodorsal artery. Okay, and this is going to the latissimus dorsi muscle. So this is that same image I showed you at the beginning of the PowerPoint, but now maybe it will make a little bit more sense on what you're looking at. So here's axillary artery. You can see the superior thoracic artery. Okay, thoracoacromial trunk. Lateral thoracic artery. Coming on down here, this is going to be subscapular artery, circumflex scapular artery, and thoracodorsal artery. Okay, coming off this way, you can see the anterior and posterior humeral circumflex artery. Okay, but remember, we don't just have arteries in this area. We have nerves, we have veins. On these images, the veins have been removed, and we do that in the dissection as well. They all have the same name, and they just are really kind of get in the way of seeing the arteries and the nerves in this section. So the axillary vein has been removed in this image, and that's typically what you'll see in a lot of these cadaver images and in the dissection. But are you like, what is all of this other stuff? Well, these are all branches from the brachial plexus, right? Because we don't just have artery in here, we've got nerves in here too. So a lot of them look the same, and the way to distinguish between a nerve and an artery, because they look similar, especially when you're just looking at a photo, but the arteries are going to be more round. Okay, arteries look a little more round because they are a vessel, right? They're carrying blood. And the nerves are going to look a little more flat. Okay, the other thing is knowing these branches of the arteries, and then as we go through the brachial plexus and those branches, seeing what dives off and is given off of these different sections. If you see this coming down this way, that's, we've talked about this. This is subscapular artery, circumflex scapular, thoracodorsal. So you have to look at where these structures are going and follow them with your eyes. This looks similar to this, right? But where is this coming from? This is not connecting up here to the artery at all. So this is going to be nerve. Okay, this, look back and see, does it connect to the artery? This main artery here. If it doesn't, it's not a branch off of the artery. Okay, now this is nice. It has everything dissected out except for the artery. So this is not what it will look like really ever, but it's a nice visualization for you to see all the branches. So here's axillary artery, right? We passed the clavicle. They actually cut the clavicle here so we could see in the axillary region. So axillary artery. So this is the first part. You can see the demarcation here and here. Here's the second part, and then the third part of the axillary artery. Axillary artery will then change names to brachial artery, and we'll talk about that in the next unit. Or not next unit, sorry, next section. Okay, so here is superior thoracic artery. This is thoracoacromial trunk with its branches. Lateral thoracic artery. Subscapular artery. Circumflex scapular artery. And thoracodorsal artery. Okay, this is anterior and posterior humeral circumflex artery. Okay, so here they are named. So here's, this is actually superior thoracic artery, even though it's not labeled on this image. Superior thoracic artery, thoracoacromial trunk or thoracoacromial artery, okay, before it gives off these little branches. Lateral thoracic artery, subscapular artery, and then it gives off this branch that dives back posteriorly. Circumflex scapular artery, and then this one continues down. This is thoracodorsal artery. Okay, going over here to the humerus, going anteriorly, this will be anterior humeral circumflex artery, and then posterior humeral circumflex artery. And this is an image from Olinger, and I just wanted to go ahead and include this. We're going to cover brachial plexus tomorrow, but this is where the brachial plexus is going to be all around this artery. So again, that's why I was saying finding this main artery here, the axillary artery, and then looking for the branches coming off of it. Okay, and then that's how you can distinguish whether it's an artery or a nerve that you're looking at. Okay, because we'll be identifying all of these structures and all of these nerves in here as well. Okay, and this is from Grants, and that's showing you the same thing with the nerves still intact here. Okay, what you're looking at here, this is an anterior view of the right arm, but what you're seeing is everything's been removed anteriorly so that you are all the way down to the subscapularis muscle. Okay, so you're looking at the anterior portion of the subscapularis muscle. So on the posterior side of this would be the subscapular fossa, or the anterior side of the scapula. Okay, here's the coracoid process of the scapula. Just for reference, here's greater and lesser tubercle. Okay, of the humerus, head of the humerus. So the glenoid cavity would be right here. And what you'll see here, so as we were looking at the axillary artery, we saw the anterior and posterior humeral circumflex artery given off? Well, this is where you'll see it right here, deep, and you'll see it pass around to the posterior side in the quadrangular space. So the posterior humeral circumflex artery you'll see pass through that quadrangular space along with the axillary nerve. Okay, so these two will always be seen together. Okay, so axillary nerve goes to the deltoid muscle and the teres minor muscle, and it will be seen with the posterior humeral circumflex artery. Continuing with the posterior cord, and again, we'll cover brachial plexus tomorrow, but since it's up on this image, I'm going to just go ahead and talk you through it here. Off the posterior cord, you also have the radial nerve, and the radial nerve will dive to the posterior side of the arm. It innervates the triceps, and you will see that run with the deep artery of the arm. So you'll always see those two structures together as well. Okay, so radial nerve and deep artery of the arm. You'll see those two structures together in the brachium. And then this has the, if we had the subscapular artery coming down, it would give off circumflex scapular artery, which would dive back posterior to the scapula, and then continue down as the thoracodorsal artery going to the latissimus dorsi muscle. And that runs right along next to thoracodorsal nerve. So this is a posterior view here. So this is the spine of the scapula. This is the acromion. Okay, this is greater tubercle of the humerus. Here's your glenoid cavity right here. So what you're looking at, we would have supraspinatus muscle up here, superior to the spine of the scapula. Infraspinatus muscle would be inferior to the spine of the scapula. So you can see that over here. Here's supraspinatus, infraspinatus. And then the teres minor muscle. Here's teres minor. Teres minor, here's teres minor. Okay, the teres minor is superior to the teres major muscle. Sometimes they don't look that different in size. Remember, these are named for their size. Minor is smaller than major. But the minor, in this case with the teres muscle, is always superior to the major. Teres minor also will go posterior to the long head of the triceps. Okay, so this is long head of the triceps. Teres major will go anterior to the long head of the triceps. So again, you'll see going through that quadrangular space, remember I told you the axillary nerve will be seen with the posterior humeral circumflex artery. Okay, so you'll see those in that quadrangular space through the posterior side. Down here, this is the triangular interval. So this is seen between the tricep heads of the triceps here, and you can see radial nerve and deep brachial artery. And this is a cadaver image here. So this has trapezius reflected, latissimus dorsi reflected back, and the thoracodorsal nerve and thoracodorsal artery go to the latissimus dorsi. So where did the thoracodorsal artery come from? It was off of the subscapular artery, which is a branch off of the axillary artery. So this is its final destination here, looking at it with the latissimus dorsi reflected from a posterior view.